Alright, this is the image evaluation for the Barium Enema trigger. So the first image we look at is a scout image, which is like a KUB. You're looking from the diaphragm down to the pubic symphysis, and you want to see the entire colon. And you center at the iliac crest. Next image is an AP projection with the patient in the right lateral decubitus position. Again, your CR is at the iliac crest. And you want to see the area from the left to the right colic flexures. No rotation, and you're looking at air fluid levels. And what you're looking for is the medial side of the ascending colon, which is about, where's my mouse at? Right here. And then you're looking at the lateral side of the descending colon, which is up here, again, to see the air fluid levels. Next picture is the right lateral projection. You're looking at the rectosigmoid area. Don't want to see any rotation again. And this is done by having the hips and the femora superimposed. You can see this is a good image right here. And you center at the as is. Next image is the PA oblique projection, and the patient's in an RAO position. You rotate them 35 to 45 degrees. You want to see the entire colon, and what you're looking for is the right colic flexure to be less superimposed than the right. So did a pretty good job here. And then still wanted to see the colon, ascending colon, cecum, and sigmoid colon. And the next one is the PA projection, and the patient's in a prone position. And what you want to see is the entire colon with both flexures and the rectum. Again, you don't want any rotation. This is a good way to see is looking at the spinous process of the vertebrae. So they did a pretty good job here as well. And the barium is going to be right here where the transverse colon is, because it's more anterior than both of the flexures. Next image is the PA axial projection, and the patient's still in the prone position. And the angle that you put is 30 to 40 degrees caudate for a PA. It'd be the other way around if it was, it'd be 30 to 40 cephalad if they were in an AP position. What you're looking for here is the rectosigmoid area, and you're going to have less superimposition than on the regular PA projection. So you can see a whole lot better right here. Next one is the PA oblique. Projection in LAO position. Again, you center at the iliac crest, and you want to see the entire colon. With the left colic flexure is going to be less superimposed this time than on the RAO. So there you go. And it's still superimposed, but a lot less than the other one. This is way superimposed, but yeah. Next image is, let's see, this one is the PA projection, and the patient's in a left lateral decubitus position. And what you're looking for is, you want to see from the left to the right colic flexures again, down to the rectum. No rotation. Again, look at the spinous processes in the vertebrae. And then you're looking for air fluid levels like the other decubitus position image. And you're looking at the medial side on the descending colon, and you're looking at the lateral side on the ascending colon. And air, barium. And then we have our last image in the BE exam, which is the post-evac. And you want to see that the barium has moved, and well, that the patient has gone to the bathroom and, you know, done their thing. Still some barium in there, which you can tell right here and, you know, here. So after taking this image, you tell the patient to drink a lot of fluids to make sure that the barium travels all the way out of the colon and is out of their system. Don't want anything to, you know, stay in there. And then the BE exam is performed to like look for, you know, various things. One thing is ulcerative colitis, or I think it's the cobblestone sign, which you can see all of right here. This person has a crazy amount of it. And another thing is the apple core sign, which is a sign for neoplasm, which is like, it's a cancer pushing down on the colon. Which you can tell here. It looks pretty good image of that. And you also use it for other things like polyps, ticks, you know, things like that. So yeah, so that's the end of the video.